Let me see this. No, my goddaughter did something like that. She's doing a project. It's supposed to be like a spring. It looked like a spring, but it's a big deal.
All right, so we're building a quality framework today. So our three categories are, what's the first one?
Outcome.
Is outcome the first one or the
Yes,
last
ma'am.
one?
Outcome was the first one, but it's basically structure.
Now, if you go
We're
by
gonna
the
start with
book,
structure.
if you go by the book, the way it explains it, it says structures, processes, and then outcomes, but the framework of quality starts with outcomes, processes, and structures.
So we'll go structure,
Processes and outputs. I swear I want one of those boards at home.
Man, Kay's going into labor over here.
All right, are you okay?
She is going into
It's
labor.
just female stuff. Well,
All right.
all females.
So who wants to give me the first example of structure? Yes, ma'am.
Staff qualifications.
Staff qualifications. That's important, right?
Yep.
Why is that important? Anybody can answer this.
They better know how to
Qualified to
do
do their job.
Gotta be qualified to do their job. And if we think of structure as our foundation, if we don't have qualified staff, how can we ever have good outcomes,
Yeah.
right?
It determines the nursing home's capability to deliver adequate level of care.
Right. Very good. All right, who else has an example of
Policy.
structure? We'll take you.
Home life environment facility.
So we'll say a home like facility environment. And why is that important?
Patient comfort.
Patient comfort, all right. Anything else? What about safety? If it feels like home, maybe they'll feel more safe, secure. Any other examples?
I said home. I said something.
Adequacy
No.
of
Yeah.
supplies.
Policy.
Policy.
Obviously, you said policy.
All right.
Rules, regulations.
Let's talk about policy. Why is that a relevant structure?
Because if you don't have any policy, people could do whatever, and not only that, but they could go into lawsuits and misbehave ethically. You have to have a work
Okay.
ethical
And
stuff.
also
So
because
that
of-
protects us.
Yeah.
Because
All right.
of insurance payments to Medicaid and Medicaid, we have to follow policies to get paid to.
So connected to our money.
Right.
All right. Another example of structure?
Skill.
Layout.
Equipment.
Skill level
Yeah.
of staff.
Yes.
Sure, yeah.
Skill level.
Skill
And
level.
staffing levels. It says skill levels and staffing levels.
All right, why is that important?
Okay.
To give the best quality care
Thinking that,
and to make sure you have enough staff per ratio.
yeah, variety of skill, so you have enough different.
Yeah.
Variety of skill?
Mhm.
Variety of skill. Because we got to be able to care for all types of patients. Complex patients, as well as patients that don't require a lot of attention. Any other structure? I got 7 people. I got 5 examples
Layout.
of structure.
Well, that's
Design.
the same one she had.
Adequacy of supplies.
You said
Equipment.
design
Mm-hmm.
of what?
The whole facility.
Facility design. Why is that important?
Hopefully it looks pretty enough for people to come in.
Not just besides aesthetics and how it looks. Why else is facility?
Safety.
Yeah,
Safety. You know, we're dealing with what type of population?
Privacy.
Elderly
Yeah.
population, right? So the design needs to be one that's
Elderly friendly.
exactly elderly friendly
And it can be for their privacy too,
and privacy, right?
the way it's set up.
Equipment.
Furnishing.
Furnishings.
Yeah, like supplies.
That's a good one. Why is, furnishing sounds kind of, why might furnishings be
You need to
important?
have clean
Pleasant.
furniture.
Unpleasant
You
to
don't
be
need bed
around.
We
bugs
need that
all
neat and
around.
comfortable bed.
Ergonomically designed.
Yeah. Which is, again, going to be important for our population, right?
I'm just worried about the bed bugs. That's
So should this be slash beds?
Mhm.
Yes.
That's the most important, because most of the
That's
rest
where
of
they'll
it
be
is
most of the
sleeping.
time,
Yeah.
most of them.
Oh, man.
Any other examples of structure?
It says facilities on here,
Says,
inadequate supplies, yeah.
She also says equipment.
yeah, we don't have equipment,
Yeah, I said
which
that.
is very important. We can't really provide services without equipment, or can we? Right? And supplies. All right, so our list is looking good.
Looks good, we covered it all, it's in the
I
book.
think we got program.
Yeah, like activity program,
Programs
therapy
is
program.
under
It just,
Is program
a
structured?
structure.
yeah.
It's under
Sure.
structure.
All right.
You have to
Possible.
create a program into the structure.
It's on 504.
Anything else I need to add to this column? All right, so we got our structure. Now we gotta move to our processes.
Cleaning.
The hygiene and.
Cleaning. It's the first thing I heard.
Okay. Cleaning.
What's so big about cleaning?
We gotta be sterilized.
Pest control, food preparation,
bugs.
bed bugs,
Bed bugs.
nosocomial diseases, infections.
Infection.
Bacteria and viruses.
All right,
Food preparation.
Yeah, food.
food preparation.
And hydration.
Has to be timely, right?
And kept at the right temperatures for.
The,
A lot of these-
Dietary you have to have, yeah.
Dietary. A lot of these residents are probably going to be on some type of medication. So it's going to be very important that dietary and food preparation are on time so that, you know, they're able to eat and take their meds and not get out of sync with their, whatever their regimen might be.
we got the hygiene.
Sorry,
Activities?
activities. That's a process?
Yes.
Sure.
Mm-hmm.
Okay. Let's talk about that one a little bit.
Activities
Yeah,
as a process
yeah.
during, for the elderly, they probably do.
Therapy?
Yeah, therapies,
Therapy.
walking, swimming, aerobic.
All right. What other type of processes do we have?
Accurate billing.
There we are. That's a good one. Accurate billing. We all know why this is important. We don't get paid, we don't stay open.
Communication
Communication.
with family about patient status.
Communication with family.
Safety. Safety.
Safety.
Yeah. It's in the book.
I'll take that. Definitely important with a vulnerable population. Any others? I feel like we're missing something.
Hygiene was part of that. Hygiene not part of that?
Grooming, like cleaning.
You said grooming, I said hygiene, but I don't, was that part of this one?
We'll put that under cleaning.
Okay.
Hygiene.
Assessment is considered as well.
Care planning?
Care plan.
Yeah.
Yeah. Write that down.
I heard assessment.
Yeah.
Okay. Quality. This is an important one.
Yeah, quality improvement.
Quality
You got
improvement.
You
maintenance?
said that already.
I'm sorry?
Yeah, maintenance.
No, but we need to add it. Quality improvement, maintenance. Very important. Any others?
Comfort. Comfort.
Conference?
Comfort.
Comfort.
That'd be promotion of patients' right, promotion of patients' health.
Comfort of residents? Got a nice list going.
You forgot an I.
She said you forgot an I.
R-E-S-I-D.
Thank you. Is that it?
Yeah, that's a lot.
It is a lot. And that brings us to outcomes.
Goals achieved.
That was quick. Goals achieved.
Patient satisfaction.
Negative outcomes.
Patient satisfaction.
Quality load.
What was the third thing?
What did you say?
Oh, negative.
Yeah, negative.
Oh, the
outcomes.
negative, yeah, negative. Mhm.
Negative what?
Outcome.
Outcome.
Mhm.
And then Ms. Snow, what did you say?
I don't know. Everything I wrote down.
Someone had another one.
Drug interactions.
Quality, I got low quality.
Customer
Mhm.
Drug
satisfaction.
interactions.
What interactions?
Yeah, patient
Drug
satisfaction.
interactions.
I'm sorry.
Oh.
Drug interactions.
Actions.
Drug interactions.
Drug interactions. Yeah, that's a good one. Interactions. And then I heard another one.
Customer satisfaction.
Customer satisfaction.
Patient,
Well, we have
customer
patient satisfaction. Same.
See? You don't even know.
Customer could be doing with their family though.
Yeah.
Not just
you
the
can have
patient
patient
itself.
satisfaction, then you can
Because
have
the-
mom
All right,
satisfaction.
what?
Yeah.
Yeah.
Customer satisfaction.
It says abuse, accidents and abuse.
Clinical
Survey
errors.
report, accident.
Clinical errors.
Yeah.
Negative outcomes, minimize. What that's supposed to be. So,
Unsanitary conditions.
Let's go with unsanitary conditions. Any others?
bed bugs.
Any others?
They upset me.
Abuse.
Abuse. Okay, any others?
Survey.
Survey?
Good enough.
It says, in other words, all cases, outcome issues can be addressed only by a retrospective evaluation of structures and processes and by taking appropriate corrective action. I was just reading out. It didn't have to do it.
So, are we done?
Yep.
Looks good.
All right, so we have all these examples of structured processes and outcomes. If we're thinking in terms of our long-term care facility or our nursing home, there's no way we're going to do all of this at once, right?
Mhm.
So now that we have this nice list, we need to go through and figure out which ones we're really going to focus on. So let's pick a couple from each column and to build our framework.
I'll pick staff qualifications, policy,
Furnishing.
Okay, how
equipment.
many we, oh Lord, how many we picking?
Let's go with how many you think we need?
Furnishing.
3, 4? Let's do 4.
First of all, you need facility design. Without that, you wouldn't know exactly what's to go. Construction-wise, you have to have facility design.
Facility design?
Yeah, because that's including the interior and exterior.
So we need one more.
Furnishings.
Is that our final
I
answer?
would go.
No,
Okay,
you
but
don't need
with the,
equipment to
yeah,
work
because
on it.
Supplies.
The
Like,
skill
yeah.
level and the staff
Oh, yeah,
qualifications
skill
are
level
together,
staff.
right? Wouldn't that be
I
together?
mean, you need more than 4
Yeah.
because you
Okay.
still need equipment, you still need beds for them to sleep on.
Well, that
Yeah.
would fall under the
Supplies.
facility design
Well,
though.
we can put the bed, the beds can fall under the facility design, but
And-
I do agree with you that we have to have equipment.
Skill
Yeah.
level and staffing can go under staff qualifications.
Correct.
Program could undergo.
And you would put
policy.
supplies, right? Because you would need that.
And variety of skill can go under staff qualifications. Furnishing
we
beds
good
and
with these
facility
5?
design.
Okay.
Supplies, yeah.
Everybody agree on that? All right.
Food preparation, you gotta have that one, and
Food
dietary.
preparation,
Yeah, food and dietary.
accurate billing,
Yeah,
Safety
safety,
and cleaning.
quality
and
Yeah.
dietary.
Cleaning.
Quality improvement.
Yeah.
Assessment.
Wait. We can't choose the whole column. We have 4 now.
Well, with assessment, it falls under safety, well, safety falls under assessment, safety falls under the
Safety
cleaning
care
and
plan
hygiene.
too. so-
Assessment is basically does overall those stuff anyway.
So where are we?
Care plan?
Well, I gave mine, so y'all go ahead and find it.
Care plan?
And you have to have.
You better know your care plan for your residents, or else you won't.
Yeah, because with that, we can put confident residents
Would
under
that fall
that.
under the communication with the doctor as well as the family?
Care plan?
Yeah. Would
Yeah.
that fall there? Okay.
Well, they can fall under care
Yeah,
plan.
Yeah.
All of K's input. That was the
Are we okay with that?
Yep.
All right, outcomes.
Goals
achieved.
All right. You see, goals are important.
Yeah.
Patient satisfaction.
Patient satisfaction,
abuse
Clinical
survey.
errors.
clinical errors,
And survey. Survey falls under.
Abuse survey.
Abuse.
A survey falls on the patient satisfaction.
Yeah.
abuse.
No, no,
Would that be under the
preventing abuse,
the
no,
negative
no.
outcome? Wouldn't it be under that?
Yeah, negative outcomes includes the drug interactions, like you said.
Nah, man, abuse don't fall under.
It says in the thing, negative
No, it falls under
interactions.
negative
It
outcomes.
says drug interactions, accidents, abuse, nosocomial infections, or pressure ulcers, in the parentheses beside it.
So we have goals, achieve patient satisfaction, negative outcomes, and clinical errors.
Kristen doesn't agree.
Oh, Kristen doesn't agree.
Nah, I don't agree with Kay.
I didn't say
I
nothing.
don't agree with nothing she said.
Any others?
What's that, unsanitary conditions, that fall under.
That, yeah.
Yeah, that's
all
all.
good.
Yeah,
It
we have to
falls
have-
under.
Well, we have to have the administrator hat on?
Yes.
I would go with survey. How are you gonna know if your goal is achieved or your patient is satisfied if you don't do a survey or something?
That's why you have patient satisfaction. You
Customer
can do
But before you have
satisfaction.
patient satisfaction, it has to be a survey going out though, right?
So
Right.
you're saying we should check survey and take patient satisfaction out?
The survey, basically.
I think it's the same thing.
It's the same
So you
thing,
can
but-
call it patient satisfaction and do surveys under patient satisfaction, or you can do surveys and say it's patient satisfaction. So it's either way.
Yeah.
Okay.
But not all patients are competent enough to tell you if they're satisfied through an through a survey. I mean, families are, and some patients are, but patient satisfaction can be managed on those patients that are not, like have Alzheimer's and stuff, by staff members and stuff like that, right?
So you're saying we don't need it?
No, I'm saying we do need it.
Yeah, we have it.
I thought we were talking about patient satisfaction versus survey.
Yeah, we're gonna keep it like this. It's the
Okay.
same,
Okay,
pretty much the same thing.
right.
Are we done?
Yep.
Please.
That was pretty cool.
All right. So we have picked out, is anybody writing this down or no?
I wrote
I
some
thought all
of
of
them.
it.
All right, so we picked out the ones we want. So now we have to figure out how we're actually going to put it into play. So,
Well, I don't know about.
can I add a new?
Why nobody picked out furniture and beds? I don't think we need it.
Oh, we said that that would fall under facility design.
Oh,
I don't think so.
it is.
I don't think so.
No? We need beds?
You're not gonna have a facility design if you don't got clean beds and there's bed bugs eating up all your people.
Give her the
Oh, I
bed.
thought you said you was gonna put that under the facility design.
Yeah,
That's why I
Yeah,
meant
but
that.
she wants
You
it
gotta have
separately.
clean, like if you got facility design all day with dirty beds.
I thought this
Well,
was
design means
facility
layout
design.
of the facility.
That's what we said, but she wants it different.
But she
I
wants
want
it
it.
different. It's because she's
Let me have
special.
it. I don't
She's
agree with
special.
nothing.
All right, so if we think in terms of the PDCA cycle, which is in your chapter, can somebody tell me what that cycle means? What it stands for? I'll give you the first one.
So like PWC?
What is it called?
PDCA.
It's like a cycle that they go in.
First one is plan.
Planning, directing, controlling.
What are the other three? You're on the page right there.
Steve stand for develop.
I've seen that.
It's plan, or it's,
What page did you say we were on?
I'm on page 514, I hope that's it for the right. It talks about the system.
Oh, the
Plan,
PDSA.
do.
Thank you.
Study.
Do, study.
PDCA.
Study and act.
Uh-huh.
Oh,
Plan, do, study, act.
Where's the C coming from?
I don't know.
Change.
Change? Yeah.
Can somebody tell me what the A is?
Act.
Thank you.
Plan, do, study, and act.
No, it's not studying.
Well,
It says right here, plan, do, study, and act. The
But up there it says
PDSA.
study, do, check,
ours
act.
is different.
It says
but it's a
PDSA in the
Yes, a
book.
PDSA, that's why I was
Yeah.
wondering, yes,
Yeah.
PDSA.
Study.
Yeah.
Oh man, we got an advisor that already knows what you're talking about.
All right. So we think in terms of this cycle, and we think about the characteristics that we just chose. How do we integrate that into the cycle?
As far as what we pick,
Exactly.
Plan out the
Oh.
layout and design.
planning is the
Continuing.
building design.
Right?
The what?
Select the processes for improvement out of what we,
So
Okay.
with the building design,
Mm-hmm.
there will obviously have to be some plans going on. We might have to meet with some architects, right? Some construction people.
contractors,
What else?
health department, health inspectors.
The zoning and stuff like that.
Zoning,
I would say planning, also policy.
planning the policy.
Right.
Might require us to review our old policies or review policies of a nearby facility or a similar facility to see what their policies are, right? Anything else? I can't remember, I did,
We have planning, and we can also do staffing level, which is the staff qualifications.
so staff
What we need.
qualification, during the planning period, is gonna require us to do what? Evaluate our staff, what we have right now, what we need. We may have to go out and do more benchmarking on the market to see what skill level the next nursing home facility has with their staff, right? So staffing assessment will be done under the plan. Anything else?
Planning on what equipment we need.
Equipment, so we're gonna have to price out stuff. We're gonna be working with vendors, right? That's all gonna be in the planning stage. Anything else? So if we moved on, the do would be what? Actually
Actual
building the
measurement,
design,
data
right?
gathering.
Implementing the plan.
So we would say this is construction.
Hiring.
Hiring, equipment purchase,
Setting up. Meetup and stuff.
Maybe policy book, policy manual.
Interior decorating.
What else might be during that stage?
Interior
Decorating.
like the interior decorating, meaning putting the bed where it's supposed to be at and furniture where
Interior.
equipment's supposed to be at.
Furnishing and all that.
I'll just say interior decorating.
I'm gonna say, when you're building, safety.
Safety.
When you're building a building, safety, when you're getting equipment and policy, writing the safety values.
So the do
Safe hazardous, safe
would
assessment,
be,
quality assurance, something like that.
all right. Say quality assurance. All right, check.
Yep.
How are we gonna, or study, how are we gonna check or study this stuff? Let's start in terms of the building design. How would we study that?
Look at
It's basically making sure all the equipment's working properly. making
Well, we're
sure-
starting with building design.
Oh, building design, making sure that it's up to code and it's not,
So inspection.
Yeah, that one, that's what I was going for, with the look thing. Look at it.
Size, make sure it was large enough, or I don't know, whatever we decided it was gonna be, I guess. Making sure we had everything that we said we was gonna have.
So capacity check.
Yes.
Make sure we within the timeline that we set down for the construction, how we gonna build it.
Timeline check.
Mhm. I guess the timeline, you can also do, resources check, if you, had the money and the,
Resources
funds.
meaning
The resources, the
finance.
funds, the finance.
the budget.
Mhm.
So budget status update.
You gotta check the.
We haven't talked about staffing yet.
You gotta make sure everybody's got their little.
what, the hiring
Make
process?
sure we have the skill level.
I thought we do
If we're
building.
thinking in terms of our staff, we've already did the planning for it, we've done it. How are we gonna check or study our staffing?
Check their background, degree.
Ratio,
Well, they've already been hired.
Oh.
Because they were hired in the due
What, training?
training. And it's not really a check, but that would be as a result of check. So I'm gonna take that back off. A check or study of the staffing would be, you guys are missing it, it's very easy.
What?
Skill level?
What do you have every year,
A
review.
Thank you.
Yeah.
right? Is that a way to study your staff or check it to make sure it's adequate?
What about like food? Don't you gotta make sure you got like stuff like that so they can eat?
For the staff?
No, like for when you
Residents?
open, you know, you gotta be able to.
But would that be here? Or would that be up here?
no planning.
We
You
didn't
gotta
touch.
check to make sure you have it.
Yeah, but we didn't discuss it up here.
Oh,
Maybe it needs to be in both.
There we go.
See?
So we're making a late addition of food. All right. For the planning,
Planning dietary.
food and dietary. And then what would the do be?
You gotta order it.
So we order the food
And hire
and our
dietitian.
space,
Inventory.
inventory.
You gotta get a company and all that stuff.
Inventory. All right, now we can come back down here. How do you want to study that?
Quality control.
You gotta,
Inventory, well,
Yeah.
that's it, no, you have inventory.
Quality control. Inventory, check.
taste testing.
All right, now we're down to act.
I did say taste testing.
If we go through everything that we've talked about up here, what happens in the act stage? Start with building design.
Open.
You implement.
All right,
Start bringing people in.
we're gonna open.
Send out
Implement the procedure.
What about
Provide training.
policy?
Hand it out.
Hand it out.
Communicating and updating
seminar.
the procedures, policies and procedures.
Provide,
Have a seminar.
training.
Training,
There you go.
Meetings.
Yeah.
meetings. What about equipment?
Making sure it works properly.
Well, that would be here.
As a check.
So act would be actually using it
Using
on
it.
the residents, right?
Turn it on.
Using equipment.
Yeah, you gotta plug it in. Advertise.
Advertise.
Brochure and stuff like that.
TV. It's like family tech. 2 + 2 = 4.
Any others? So hopefully, the diagram in your book shows a circle, right? With the P, the D, the C, and A, correct? Or S.
Yes, ma'am.
So what we've done today is we initially created our own quality framework that was composed of processes, structure, and outcome. And then what we did was we integrated it into this cycle so that you can see how the framework will be implemented through this cycle. And this cycle is often used in hospitals and healthcare organizations to make sure that the organizations are staying on track when it comes to them implementing quality in their organizations. So this cycle is going to help you as a manager stay on track. If you skip the P and you come down to just start doing stuff, you're not going to form a complete circle, right? So the circle represents making sure that you have done every step to make sure that you are implementing quality correctly within your organization. Does that make sense? Start to finish. Anybody have any questions? Looks like we have a pretty good framework set up for our nursing home.
Just move it up.
Right?
Yep.
All right. That's all I have for today. You guys did a great job.
So what's our answer?
This is our answer.
I'm gonna meet you,
I think we're meeting at the computer lab.
You know about our presentation.
Right now, right?
ATC.
Okay.
So I meet you guys
First thing?
Okay.